We are hoping we get, Praveen is here from Stellantis. We need to put a car frame there. We are hoping we'll get a, a Maserati frame for the simulation lab. I mean, Jawahar and Anbu are talking about Maruti 800. I said, we're putting up a case, let's put something much better than a Maruti 800. This is no Indian driving conditions. We'll have two then, one Maruti 800 and one Maserati. So we'll get from Stellantis. so with that we get to the two plenary panels. You can take this there. So this was the first part of the three parts today. First part was to just get an update of a lot of work has happened. Even all of us, like maybe Deva, a little bit, Verma probably have some good view of everything happening. Otherwise, most of us don't even know what else happening. It's just way too much happening. And so we thought, let's step back and look at everything that's happening. So the first part. Second part is the whole intellectual conversation, the two plenary panels, one on mobility and one on healthcare. And the last part, a short one, is on some of the innovations. We have some faculty that are going to present their research teams, faculty or their research students, going to present, we curated 5 potential, technologies that have some potential uses in the market. And we request every participant, especially all our panelists, to reflect on that and give their inputs on what is the market opportunity for each of those 5. That's the last part. And we have starters that we're working with just do lighting pictures. That's the last part, the innovation. So now on to the second part, the plenary panels. The first one is on the healthcare. So I request the panelists. First is a good friend of ours, Care India. It's a great friend of the institute, and everybody there is a great friend of me personally. And so request Debashri Bhattacharya, the Chief Operating Officer of Care India Foundation, and soon to be the CEO of the foundation as well in a month's time, Deb. Another very good friend, everybody here is a good friend, so we tend to call good friends, and we have a lot of good friends. So request Manoj Kapoor, who's Vice President, leading all of the innovation and research activities, and hopefully we'll do a lot more with them as well, heading research and innovation at Providence. Then we have another very, very good friend, personal good friend, and his name was already referred to a few times today, Dr. Chinnababu, an oncologist, surgical oncologist, one of the early robotic surgeons in the country. So he is one that can actually operate, if regulations allow, remotely. So he doesn't sit at the patient he sits at a table next to the patient and operates using robotic surgery, which could be anywhere in the world. The patient could be somewhere, but regulations don't allow, I believe. So he has to be in the room, but he doesn't touch the patient. He works on a robotic equipment and runs a fantastic NGO called Grace Cancer Foundation that does very, very large-scale cancer screening drives. And so we're doing some work with them as well. And then, of course, our own Verma to anchor this panel. Verma? There's one here as well. You can take this, Verma. I can give this to.
Thanks so much. Welcome to all the panelists. Right, so we have, all the 3 panelists bring 3 different perspectives, right? So Dr. Chinna wears actually 2 hats. Beyond all the surgical stuff, he also heads the Grace Cancer Foundation, who they do a lot of work on the primary health care, right? And then Care India does a lot of work in primary health as well, right? And Manoj, he was at Optum now he heads growth and transformation at Providence, right? He brings that angle from the corporate perspective. So the topic we have for the panel today is realizing AI at the grassroots level. And when we mean grassroots, we mean it like in the primary healthcare system, right? In the public health centers, right? If you see a lot of development in AI in healthcare over the last 4 or 5 years, right? A lot of stuff primarily has been focused on helping the specialist, right? A lot of algorithms were developed to help the specialist, whether it's a radiologist or a pathologist, right? To improve their productivity, right? That's good, but if we want to really realize the potential of AI, then we really need to see the primary healthcare system, how that can take advantage of the AI developments, right? So we'll let each of the panelists give their initial thoughts, and then we'll get into the discussion, right? So Dr. Chinna, if you want to start first.
No, well, I think I'm more excited to look at the role of AI at the grassroots level, because for the past 15 years I've been devoting 1 day a week for a community service in a district place, and I understand the nitty-gritties and the difficulties there. So I mean, as much as it's exciting that AI is there, it's going to really make a big impact. I strongly feel that at this point of time, there are practical challenges as well in terms of, you know, the deployability, you know, even, you know, acceptance in terms of the healthcare worker shortage that we have and all those challenges. But definitely, you know, I am a, you know, optimist, and I've been seeing, closely working with even IIIT and to see how technology can play a difference even with respect to screening for cancer, for example. You know, in that sense, I foresee a great opportunity to, you know, look at various indications. But one, you know, general statement, if I can make, is probably I think we need to look at problem-led solution than a solution trying to address a problem. So I think that's the one key thing that comes to my heart. Thank you.
Okay, first of all, thank you very much for having me here. And also, I basically saw some of the updates on the healthcare side. I think there's some amazing work that has been done. And I particularly believe all of that particular AI work is absolutely implementable with regard to the rural population and other things that we are going to talk about today. But first and foremost, I believe 66% of India lives in rural area. And that actually gets only 33% of the health workers' attention, so to say, or the physician, clinician attention. So there is definitely, an inequity that exists between the urban and rural. As Dr. Chinna talked about shortage of health workers, I think it's like a known fact. Also, there are not much incentives for even many physicians, clinicians, or other health workers to basically go and work in a resource-constrained environment. So given all these particular constraints, I do not see any other way but AI coming to the help in order to solve some of the challenging problems at the grassroots level. Now, during the conversation, I'm sure that we're going to talk about what those particular challenges are and how AI can really help, so I'm not going to dwell into that. But I also particularly believe that caregivers' experience is also very, very paramount. Many times we come up with solutions which are very complicated and complex, and we know that at a grassroots level, there could not be an adoption of those particular technologies to the extent that we would like to see. The infrastructure, of course, the connectivity is actually improving quite a lot, but still I don't think that we have reached the last mile. There is a lot of work need to be done on the electricity side, on the infrastructure side, in order to basically make sure that all these good technologies that we're talking about are really going to make an impact. Last but not the least, I also believe that there are some foundational and fundamental changes that need to happen from an Indian subcontinent perspective, which is like some of the very basic fundamental things with regard to health literacy, which is actually missing at this point in time. There are a tremendous amount of examples that we see today where there are government schemes that are basically not being utilized. There are incentives and campaigns after campaigns that are basically done, but many of the rural population, because of the poor literacy, health literacy, they're not really even utilizing many of those. So we can definitely talk about AI, and data is going to play a big role, and we're going to talk about that in a minute. But I think some of the fundamental things also need to change in order for us to really implement AI.
First of all, again, thanks a lot for having us here. And I echo Manoj's thoughts on what we heard earlier as well, in terms of the kind of innovations that you're already working on. So I would definitely want to be more engaged going forward. And on this panel, I think that I truly represent the problem side of the equation. And I also
given all the work you do in Bihar and all the other places.
Yes, and also professionally in care, we actually deal with issues at the grassroots. We hardly get the opportunity to move beyond that into policy making. And personally speaking, I have spent about a decade with a donor like large-scale donor like Gates Foundation, who has invested a lot in health system strengthening. So what it has taught us is to look at the entire health system, or the primary or a public health system, with a theoretical frame, if you will. And those are the typical WHO building blocks of a health system. And I believe that going forward, if we start also using a similar frame, maybe not exactly the same frame, but similar frame to actually elucidate more of the problem statements, might be useful to fit the solutions, as Dr. Chinna was talking about. So the first element of a building block, if you will, is governance and leadership. Now this is an area where AI, data-driven tech introductions has been a little soft, if you will. So how do you solve for governance issues when it comes to with AI solutions or with data-driven solutions? But I think that at the end of the day, modeling the impact of what happens, the activities which happen at the last mile, how do they impact finally at the population level, the health outcomes, is something that needs to be evaluated in real time, because that defines how the entire health system is governed. So this is one area perhaps where AI or data-driven tech can actually come in and solve for many issues. The other one is that we typically feel that a public health system is only the services that are delivered by the public facilities or the public delivery system. But the health system is more than just what is delivered by the public system. The governors of a health system, the administrators of a health system need to look at the entire health system. It often, what ends up happening is that the population health impact is not defined so much by the people who go through the public health system, by the people who escape the public health system. So we need to keep a track on, or at least the administrators of a health system need to keep a track on where people are actually going. It's like a real-time Google map of where people are going, why, what for, how much are they spending, what are they getting, etc. So these are issues of governance. I feel that AI solutions can help. The other one again, where it is deployment of AI has been a little soft, but I feel is needed much more, is in human resource management. So the HR, the paucity of doctors, etc. But also what competencies, what mindset of people need to be deployed at which place. We know that India is primarily rural, and rural societies, even in urban societies, we have different fissures in our society. And one size doesn't fit all. So there are tremendous caste fissures in a place like Bihar, where we have worked for more than a decade now. We see that some types of providers are welcome in a particular community, sometimes are not. And yet there is no way the government or anybody who is the administrator of the system can track who is best placed to be deployed at which community at the grassroots. So these are things, if data can actually objectify all of this, then it will be very helpful. The third part is about financial management. Again, financial management, the government health systems or the public health system typically works in a very switch-on, switch-off mode. So when they do the budgeting as if nothing has happened before. It's a zero-based budgeting. So it's a switch, which they switch on, and same amount of money flows every year for the same set of activities. AI, I feel, can actually turn that switch into a knob, that how much you can regulate. Thoda kam, thoda zyada. Not completely switch on or off. So that kind of budget and expenditure management, expenditure planning in a public health system delivery is very, very important. I also feel that in terms of the private financial management, AI can actually help develop a lot of point of care innovative financial solutions. What kind of co-pay stroke insurance products can be brought in for what kind of disease states narrowly? Because today I think that financial instruments are also very few. There is not too much of flexibility, there is not too much of innovation in financial instruments which relate to health financing. Of course, a lot of work is going on, and I think that will continue to go on in the other three building blocks, if you will, which is the supply side of things, the drugs, equipment, etc. Of course, information flow, as well as the service delivery part. So I will probably stop in the areas which are more neglected, I feel, in the building.
So I'll ask a specific question, Dev, then we will start with you, right? One thing that goes across all these things, if you see what the government has been trying to do at a population scale, right? Big projects, right? Aadhaar was one, right, where at a population scale, and with this UPI, now you have very widespread, right, digital stuff, right? Now there is similar hope that Ayushman Bharat digital mission, right, can put the rails, right, on which a lot of this thing can be done, where proper data can be collected and a lot of this analysis can be done, right? What do you see? I mean, now it's almost like couple of years now where the things have been finalized and things are being piloted. What do you see at the ground level, right, of an impact of a program like that?
See, to be honest, I feel that this is a necessary but still an insufficient step, what the government has so far done. And I feel that the key to this lock perhaps does not lie in ABDM or in the tech sandbox. but lies in an entirely different place, which is how the CAG audits government finances and how government procures these platforms. At the grassroots level, the medical officer in charge of a primary health center has zero idea about tech, any tech for that matter. He or she ends up using what comes from top. That this is the database, this is the digital platform you have to ask your people to use. This is the MIS platform where you have to record data. They have zero say in this. So to an extent, the sandboxing, all of these, various variety of tech platforms is pretty moot at the grassroots level. Till the time they are A, made aware of this, and B, they can actually procure these platforms. And I feel that we also have to, the third step which we have to take also is how the government looks at sharing data. Because data cannot leave government, period, that we are seeing every day. Right? So how much of these platforms can infiltrate or be allowed to infiltrate is a bad word, but can be insourced to work within the government's own data firewalls is a challenge which the government has to solve for. So I'm all for, the first steps are correct, but till the time we get the hiring, the procurement systems right, the government will procure anything the same way as they procure anything else. The same procurement committee will sit for, procuring the socks and shoes, which they will procure for any digital tech.
Anything more you want to add, Manoj?
Yeah, I think those are some very practical challenges that you talked about. I'm a little more optimist about this entire thing. Having seen the broken systems of US healthcare, I particularly believe that ABDM has been a very, very bold step. Coupled with universal healthcare that the current government basically launched, we have been spending a lot of money, not really a lot, like less than 2% of the GDP on the healthcare. But we have been spending that particular kind of money, not really giving it in the hands of the consumers so that they can actually take care of their health through the insurance channel. Now, and that is the reason probably many of the private hospitals have been kind of shying away from going to these particular regions because not seeing that there is going to be enough money there. But now if there is money in the pocket in terms of the insurance card, I believe that this is going to definitely be a game changer. But coming back to ABDM, I think the blueprint that has been put in place is, in all sincerity, is probably one of the very unique things that the world is seeing that India is basically up to. A lot of countries have basically tried to do national health information networks, NHINs, but not many have basically successfully implemented those or have actually figured out the value of those. Barring those particular things, in case I think the procurement can be taken care of, they basically look at the right kind of solutions. I think the interoperability challenge that many of the other countries have seen, we will not see that particular challenge at all. So we will actually completely move away from the challenges that we have seen that rest of the world has basically seen. Now coming back to the topic where the AI and ABDM can really help, I believe data has been the biggest issue, specifically when it comes to the rural population. Leave aside the longitudinal record of a particular villager, you can't even get episodic records in the right place. So there is absolutely a challenge with regard to data completion, data inconsistencies that exist today. I'm actually hoping the way ABDM blueprint is going to be implemented, that will provide an electronic health record for each and every individual, an informed consent that will basically make sure that the data travels to the right kind of people where the patient basically is completely in control of their patient health records. And much more predictive modeling can actually be done based on that particular kind of a data set that will come. Also, I believe at a regional level or at a local level and then at a regional level, because there is so much of disparity across our country, whether it is in terms of social determinants of health or social economic concerns, as well as also some of the demographic factors that lead to specific kind of disease patterns in a particular region. I think this kind of a data set can even be useful for epidemiologists in order to figure out what are the kind of interventions that they need to do. And I remember, like in my previous organization with Carnegie Mellon University, we had actually put together something called as a FluCast, which can predict the outbreak of flu 6 weeks in advance. So like imagine if this particular data that is available coupled with this, with the environmental data and other social data in order to predict certain kind of patterns that can actually help in figuring out what kind of population health management things that needs to be done, as well as also interventions or forecast any kind of a disease or an outbreak of a particular flu, so that we can absolutely be prepared in order to take care of that kind of a problem. So I'm very, very positive on how this is going to really help in the next 3 to 4 years.
Yeah, absolutely. Right. I mean, that's what Professor Bapi talked about, some other things, and especially within this institute, in this applied AI efforts, right? This is our goal, to really get these multiple stakeholders and under umbrella, right, to put these data sets together. It's not easy, right, especially in the healthcare domain. And I've been, talking to a lot of stakeholders in the primary healthcare, right? Everybody has an idea, but then actually to get something moving forward is not easy, right? So Dr. Chinna, switching a little bit, right? I mean, we've been talking about AI in healthcare for a long time. From a clinical perspective, right, what change you have seen in terms of clinical acceptance and deployments in general, right?
At the grassroots?
At the grassroots, and generally AI solutions.
No, in general, I think AI solutions in terms of acceptance, it's still again, I feel there is a lot of equity bias, because the private players are controlling whatever solution available. For example, in oncology, we have this IBM Watson solution. The many parts of the Apollos have been using, but it is not accessible for anybody else in that sense. So in that way, there's still again, even though you have a solution, but there's again a big divide as such, especially from the rural context. But I see a great opportunity in terms of the robotic surgery, in which, I foresee, as Ramesh was mentioning, right, telesurgery was done 25 years back as such, transatlantic cable was put. So, probably I'll be operating from home very soon. Once you have the ethical issues cleared and the, the kind of transmission, especially the 5G and other technology coming up. So I think that's where, there's something called as cognitive robotics, wherein you can integrate the pre-operative imaging of the patient, and then the surgeon can really kind of do a rehearsal even before you go to theater and then perform the surgery. So in that way, I know a lot of simulation can happen, training can happen. Already, we are seeing that happening. So in that way, at a tertiary level, at a kind of urban setup, the deployment is happening.
I'll just give you an example from the organization that I just joined, and I was actually blown away by how we're trying to basically figure out that health workers who may not be as qualified as some clinicians or physicians, and because of the shortage, specifically in rural areas, there are certain very common elements or common diseases for which the health workers may actually continuously need to have the medical literature being available and some kind of insights being available and asking the right questions. So there are applications that exist today from a symptom checker perspective, so that you can actually say that, okay, I have these are the symptoms, and then it basically provides you with some kind of a recommendation. And if there are more complex cases, of course, they are handed off to a more qualified physician. From an AI perspective on how some of the medical protocols and guidelines that can actually be, use of technology in order to curate that particular content for the health worker who otherwise may not have all that information. I'm also told that a doctor nowadays had to study 29 hours in a day in order to really catch up with all the literature that is getting published, which of course is not possible. So hence how we can actually use this particular technology, whether it is NLP or whether it is like the right contextual search, in order to bring these elements of content so that we can save time and improve the productivity, and also basically expand the capacity of the caregivers community in order to kind of provide the right services. So.
Good. I'll just add one point, right? So one of the projects we're working on with a startup called Blue Semi. They've been piloting this for the past 7-8 months, where they have a non-invasive device which can give you blood pressure and blood sugar, right? So far it looks promising, but if our goal is to really give it to a ASHA worker, right? Because they can't do this invasive stuff. If they can collect the data and give insights at that level with this kind of information, that'll add a lot of value. Right? Yeah.
I just wanted to add to what Manoj was saying, that non-physicians can actually do a lot of more can provide a lot of more services and with much better quality if they are given this fillip, this just an add-on just at the right time for the right disease state. But I feel that from experience in a place like Bihar as well, right? So what we did was we spent a lot of time in actually hand-holding, literally hand-holding and mentoring these ANMs who were the only ones who used to go into the labor rooms. Doctors hardly went into the labor rooms. They still don't go in the labor rooms in the PHCs, at least in the primary health centers. And Bihar gives birth to 3 million kids every year. So the entire load is taken on by the shoulders of the ANMs. So the ANMs, we handheld them, mentored them, and this journey is very important, where they start feeling comfortable with an anonymous voiceover or a non-person, a non-human counseling them at the right time. So we spent 10 years. I'm not saying that we need 10 years in every place, but that initial period of cradling them into this acceptance that a virtual voice will come over. So now the nurses and the ANMs in Bihar are, for example, telling us that give us an Alexa kind of a stuff. We will just read out the conditions of a pregnant woman coming into the labor room, and I'm okay if a voiceover tells me that this is fine. We'll do it.
Good. I mean, those are the kinds of things at the grassroots we need, right? I think we can go on for a long time, right? Maybe I'll open it up for audience and a few questions, and then we'll wrap it up for the next panel, right? Any questions from anybody? Yeah.
Looking at these AI solutions, why are we confining ourselves to medicines or medications? There are other variables which can also be looked at, like ways of organizing life itself. If you look at that also, if you change that, if AI can be used to change that, maybe we'll be able to do it with a large number of people. For instance, the hypothesis that 33% of medical care is allocated for the rural, 66 or more may be needed for urban. That may be a necessity because most of the life-sustaining resources that are used in urban areas are the manipulated things coming from elsewhere, over which the administration has virtually no control. Whereas in the case of rural things, to bring it to an extreme, the Sentinelese people living in an island, they have been living there without any intervention for centuries, for millions of years. Not millions, maybe thousands of years. So that should be at the back of our mind, at least in that Gandhian philosophy, keeping some of the extreme cases at the back of the mind when we talk about AI and its application.
If I just comment on this, I really align with what you're saying, because one big threat that is also coming out is over medicalization of everything. Yeah. So I think we should be very clear and conscious of the fact that when to tell people that it's all right not to worry. Not everything is a pre-disease state. Life cannot be a pre-phase to death.
Yeah, instead of sick care, we need health care, right? So well-being, right?
No, I think preventive healthcare is something that we need to really focus on, and of course lifestyle modification and kind of lot of work can be done on that space rather than really looking at the sick care.
Any concluding comments from all three of you, and we'll wrap it up.
Now you have several NGOs, startups, and so on, who have their own platform. I'm sure CARE has one, WISH has one, PHFI has one, and maybe we will develop one, right? So the last thing that ASHA worker wants is yet another app, right? In what direction are we going? What is the larger picture in these things?
See, the inevitable larger picture is
just because I saying yours is better than mine or mine is better than yours is not going to help.
very true, and in fact that is where the the government or some administrator, some central converger of all these platforms comes into the play. And if the role is that of an integrator of various information coming from various platforms, that I feel is the inevitable direction. So we'll all have to start looking at integrating all the information that is coming out. So the final decision makers, at every level there are different decision makers. It's not the Secretary Health of a state health department who is the only decision maker. Even the ASHA is the decision maker. So she needs to also feel empowered to collect information from various different platforms, but having some integrating function or mechanism for all the data coming to her. Very tactically speaking, that is why we have stopped actually developing any platforms on our own. If we don't find a buyer already in the government, either the state government or the central government, we typically don't want to invent yet another product. Uganda, for example, had issued a decree that the biggest disease that the frontline workers are facing are apps. So they banned apps. They actually had a moratorium on apps for 3 years. No more new apps.
Dr. Chera, you can probably add to that as being a practitioner. You don't want you just want your one system and everything should basically should follow into the clinical flow. But just to add to what you're saying, I think the ABDM, also the infrastructure that they're building and the foundational building block, and you have so much of knowledge on the data repository side, so I should not be talking to you on this, but the fact of the matter is I think the way they have structured these particular repositories and metadata that they're bringing together will form a foundational layer, and then there are data exchange protocols that have been very standardized. So even I particularly believe that the foundational layer is there, and if you want to build certain more innovative apps, and there can be 10 different, let's say, digital therapeutic apps on the same kind of a medical condition, that should be absolutely fine, as long as there is data interoperability, which basically is provided by this particular foundational layer. And hence, I think we will not have those particular challenges of like one particular worker using multiple different apps. It may be really but we also want to give a choice. But so the choice will be in the hands of the consumers. But as far as the the entities are concerned, they might basically come back to the same foundation layer.
Yeah, I get it, but in the current state, I think there is no interoperability, no compatibility.
No, no, no. Not even the two branches of the same hospital, sorry.
Agree with you fully. So this, the healthcare is a domain where the entry barrier is very high. And that is created by the government or the public regulatory bodies which worried about the data protection to many other things where they may have valid reason. The second community possibly is the practitioners who possibly are not as acceptable to the technology or the solutions that may come from somewhere. So is it the entry barrier is all real or it is partly artificial today? Given that a lot of technology of the technology solutions need not be replacing a human being. So there was always a fear of any technology when it comes, there is a resistance. And the resistance was very often rooted at this is replacing human beings. The old era of computerization to autonomous driving to wherever you look at it. Today it is clear that even if AI or technology-driven solutions come, they should coexist with doctors and support and speed up or make the system efficient. If you look at the public health system in India, the hospitals, the medical colleges to PHCs, if you look at it, it is highly inefficiently managed. Maybe you can complain about the crowd, the regulations and lack of people, etc. But there are a lot of places where this technology could come. Don't you think that this entry barrier that we are always complaining about is partly or highly, we only made it?
I think I will come in from the practitioner's side. Definitely there is a big reluctance from the practitioner side because we are already overburdened, and even in the biggest corporate hospitals today, we don't even find the clinical findings in your electronic health records. That's the most missing link actually. You just don't want the X-rays, the MRIs, or the PET scans, but you need the clinical findings, you need the real world. It's not just a one-time transactional data that you collect. So in that way, I think there is a big gap from the clinician side as well. But again, I think that needs to be addressed at a different level in terms of the solution for this. I think it's not the white paper or the policy that's going to change, but I think all the healthcare workers also should change their mindset. I think because as an organization from a Grace Cancer Foundation perspective, I never believed that we could digitize the data. Initially we thought we see about 200 to 300 patients each day. It's not possible. It's very easy to write in a piece of paper and dispose the patient. But today, with the app that we have developed, we're able to, initially it took some time to adopt. But today we find so much of value and the whole team has accepted it. So I think this transformation does happen. It's all in the mindset and people need to be really encouraged to change their thinking.
So you have a very strong community, for example, your own discipline sub-communities. Why these communities are not adopting at an organization or association or whatever you have? If you find value.
No, I think it's a very complex question in that sense. See, even in the US, if you see, right, still, there are big challenges for this, electronic health records. Even if they have incentivized, you've given, they made it mandatory, regulations have changed. In spite of that, there's a lot of challenges. So I think it does take some time, but maybe over a period of time, this could be. But I, as a, personally, if you ask me, I have seen dramatic advantages with this, and I would be an ambassador for this.
So one thing I learned, Jawahar, in the US, it's most of the digitization happened with a ton of government incentives, right? I didn't know that, right?
Yeah,
Especially in the EHR front, right?
The Meaningful Use, the Meaningful Use Act and other things, based on which they got incentives, and now there are going to be penalties if you don't basically use it at a later point in time. But I think this is where I think technologists have failed the doctor community. Yes, I would agree with that, and I wanted to come to your rescue. So, but that's the truth. Whether it's Epics of the Word, or the Cerner, or Meritech, or what you have, none of these particular systems are actually built in a manner. It actually automatically falls into the flow of the physician or the clinician. It's not built in that manner. It's changing, but it's really not there yet. I have actually. At one point in time, I was actually working with a VC firm and looked at more than 450 startup companies at that point in time. I actually found a few startup companies in India who had done a tremendously good job of actually creating an electronic health record system, whereby I actually came across one, I will not name, but I came across one where the doctor didn't have to type anything. Amazing. Now, I have a dream whereby a patient and a doctor are talking and a device is listening, right? And everything basically gets recorded, and the technology is at the back end, is at the play. And for US, it not only converts those particular conversations into, let's say, diagnostic codes and CPT codes and whatnot, and then it automatically uses the charge master in order to basically bill, and then automatically send the claims to the to the payer organization, and it actually on the point of care itself you can adjudicate the claim. That's the kind of technology that we need to build. Easier said than done, but that's the dream that I'll kind of leave you with.
Okay, folks, I think we're running behind, so we'll wrap it up. Thanks a lot to all the panelists, right? So we already work with them, and we'll continue to work with them, and we invite others also to join our healthcare efforts, right, to help us take it further. Thank you.
Thank you so much. I think for such conversations, like I'm sure we can just spend 3-4 hours just on this topic. There's so much to discuss. But Verma, thanks for kind of keeping it crisp and getting a meaningful conversation. And thanks to all three panelists, Dr. Chinna, Manoj, and Deb. So now we move to the next plenary panel on mobility. We have Anbu, again, another great friend of the Institute, an architect, senior architect at Intel, who works very closely with Jawahar for many years, has been working closely with Jawahar on many of our mobility projects. Many things that Verma and Jawahar touched upon, Anbu is very involved. So Anbu is going to anchor this session, and if he needs any support, Verma is here to help him, just in case we have some technical glitches. And we now request Ashok Jha. Ashok is a senior director and heads a lot of their innovation and research projects at ZF India. Ashok. Praveen Swaminathan, who is going to get us the Maserati sometime for sure. He said, I don't know about this year, but sometime in the next coming years, we will get the Maserati. So Praveen Swaminathan heads all their, so they were mostly manufacturing, and in India now they're starting their the whole ICT operations in a big way. So Praveen leads those efforts. It doesn't feel like we just met first time just a year back. He has come at least 8-10 times and been supporting many of our initiatives and looking at supporting some of the lab efforts as well. Would like to request Amitabh Jha from BCG. BCG is very involved with the Telangana Mobility Valley efforts, which is a large initiative by the state, anchored by the state. We are a part of it, IIT Hyderabad is part of it, Intel is a part of it. So when Varma goes there, like he sits in two chairs. One chair he represents Intel, the other chair he represents IIIT. And BCG is anchoring some of those efforts, the thought leadership in terms of what the Telangana Mobility Valley is about. So with that, I will request Varma to just come sit on the stage just in case Anbu needs any support. But Anbu, we are all yours now.
Thank you very much, Ramesh. Thank you, Ashok, Praveen, and Amitabh. Thank you for being on this panel. Can you hear me?
Yes.
Okay, great. And thank you, Verma, for being there. I wish I could be there in person, and I'm really missing this. But Ramesh convinced me to do this even if I'm remote. So I appreciate the panel and all the help that's extended from the event organizers. Okay. So Verma, I have given this. So maybe I'll just start with a short intro. And the way I would like to do this is I'll just open the this panel for brief comments, initial opening comments from you, and I have some possible questions which which we have already shared. So we will go through that and get your views on that, and then we will open up for the panel. Or if there are any questions in between that Varma, you think I will let you manage. In the sense, if there are questions from the audience, we can do it. I'm unable to see the audience, so I will need your help on moderating that part of this. Right?
Sure, and maybe you can just kick off on the topic, right? On the
yeah. So I'll just make a few sentences and open up. So we are on this topic of thank you for all. We are here to discuss about this emerging topic, and a very interesting topic on road to autonomous mobility. So when we say mobility, there are multiple shades of that word, and each one interprets in a different way. Autos and OEMs think that it's going to be cars, and commercial vehicle makers think that it's commercial vehicles, autonomous mobility, and people who are in social and mobility sector think that it could be that mobile platforms or movable wheelchairs or autonomous wheelchairs, or people in campuses think that autonomous cars in campuses. So this word mobility spans or is interpreted by multiple people, and we have the very heavy representation from auto OEMs here, but we would like to have an open discussion, right? So my comments would be that we are witnessing a very big technology change and revolution given the artificial intelligence and the machine learning developments that have happened in the technology world. So what started as object detection and recognition problems in the AI machine learning world led to the development and availability of fully autonomous cars now, right? People talk about Tesla, and also somehow, those who are really in the field also know about the mobilized autonomous cars. So there are, pockets of, places where these fully autonomous cars have been deployed in the real world, and we are a generation which is witnessing this technology change, right? So we living in India, are only dream about it, and places like IIIT Hyderabad are a champion in this. It's still a remote possibility on the roads of India, but it has a very significant benefit and impact for us all in India. So in this panel, we want to hear about how this technology change, this road to autonomous mobility, will impact or affect us all, not just with cars on roads, but also in other areas, as I mentioned earlier, assisted mobility, on closed campus vehicles and things like that. So with that, I'll pause, and I would like to hear your opening, remarks or comments on this.
Yeah, Praveen has the mic. Go ahead, Praveen.
Thank you. Thank you, Anbu. I think you set the ground very well. So one thing, or a couple of things I would like to say. When it comes to India, we all say that, like everyone says that India doesn't, India is too far for autonomous vehicles and so, right? I would not fully agree with that, mainly because one thing that came up in the first session also is that 50% of accidents happen in highways, right? And we have the second largest network of highways, yeah. And with the number of smart infrastructure that is getting built in highways today, there is a lot of possibility to build autonomous vehicles which can work on highways, right? So that will help us solve the biggest problems today, right, with respect to road safety and so. Yeah, so for example, if we see, we are talking about platooning use case, right, where platooning is an important thing not just for safety of the roads but also for the emission, right, to manage the CAFE requirements and so, and also reduce the CO2, right? So platooning is an important use case, and today we are suffering in our highways. If you see, that is one of the reasons the government has brought up the national logistics policy to optimize the, the movement of trucks on the roads, right? And the hub-spoke model is what they are looking at. In attachment to that is what we need to see how this platooning thing at a very early stage at least can be adopted, which can assist the drivers at the first level to ensure that you have a pack of vehicles moving together. That way you reduce the, the CO2 emissions, and also that reduces the accidents and so. So in addition to that, what data would be needed is what is important, right? So that is what the infrastructure is going to feed in. It is the cameras that you have on the highways. It is the roadside units where we talk about getting the traffic information, getting terrain information from the maps. Maps are also very important to augment this whole thing, right? So maps are, today we are talking about e-horizon, we are talking about terrain management and things like that. So these all should be complementing the solution towards what we want to do with respect to highway traffic and so.
That is really nice that you touched upon the data part of it, and it is also the theme of or the strength of this hub, right? Data-driven technology, and it rightly aligns. So thank you for your opening comments. Yes. Yep. Go ahead, Amitabh.
Yeah. So what I have experienced is that if you have to disseminate a particular concept and make it more and more popular, the best way to do is to have quite a good number of commercial use cases, because the more the industries adopt them, the more those concepts kind of get disseminated, and it kind of gets more and more common. Say for example, I was working with one of the largest tire manufacturers in India, and what they have is that they wanted to calculate something called as remaining useful life of the tires, as the the tires move around the roads and all that, and basis that they were pricing the tires for the buyback and things like that. Extremely successful programs that I have delivered for the client, and then what we were doing is that we were building some kind of ANNs, artificial neural network models. So as and when those the truck drivers or mainly for commercial vehicles reach the station of that tire manufacturer, the clearly the probability of a failure on the road, real-time probability on the failure was calculated, and that helped the manufacturer to do the replacement of the tire there and then, and do the right pricing for the customer as well. So see, the thing is that for this autonomous mobility, what we need is basically the skills, which I must tell that the kind of the way AI is shaping up in India is definitely there. And of course the capex, like whether the organizations or the companies are ready to invest in these things or not, that is also definitely there. But what I think would definitely require at this point of time is the tech and the platooning thing that you were talking about is something which will kind of bring it to pace and bring it make it more make it actually implementable, make it working on the ground.
So, I mean, similar views with the co-panelists. First of all, thanks for having me here. And I personally feel autonomous mobility is not an option. It would be definitely in place. What question is, up to what extent? It would be level 5, level 4, level 3, so or remain level 2. But it's not that a question of whether we will have the mobility which is more autonomous. Yeah, that's the point. And I personally believe autonomous mobility will not be limited to a particular segment, be it passenger vehicle, commercial vehicle, the last mile connectivity, or within the campus, your shuttles, etc. It will affect or touch every segment. Depends, some segment might follow a lead, some segment might follow. Could be various factors: technology, infrastructure, adaptation, commercial use cases. Things will, it depends. Now, in Indian conditions, I personally feel things are going, it will not come as a radical change, it will come as incremental changes. I think Professor Jawahar was talking about the driving license, etc., where basically you want to monitor the driving pattern of a particular driver. And just to let you know, Professor Jawahar, many organizations, including our organization, we are working on similar pattern, because today, you get a driving license at the age of 17, 18. You go for driving test, you get your driving license, and with that driving license, you drive until the age of 60. Your reflexes are not the same which you had at the age of 18. It changes. Your body language, your body reflection changes, your driving pattern changes. So what happened? The data plays a vital role there. If you have a dynamic monitoring of your driving pattern, which many organizations are doing, and many OEMs are also driving that. Definitely data is private, and the question comes how the data will be managed, how data will be shared. But the big data analytics, the data crunching, the AI models are certainly being built so that our roads are becoming more safer, and the driver get more assistance from the vehicle. So that's very naturally, it's on the card, and things are changing. Maybe by 2030, one thing I can certainly tell you, that the mobility industry will not be same as it is today. Now, the magnitude of change, again, it depends on multiple factors and the commercial aspect. So that's how I personally believe that autonomous mobility is not a dream, it's something which we would definitely see.
Go ahead and
Thank you. Go ahead, Verma, you are going to say something?
No, go ahead. Yeah. I was just going to.
Yeah. So thank you, right, Ashok, Praveen, and Amitabh. That's really nice to hear. And I like Ashok's comment that it is not a question of if, in a way, right? We are definitely going to get it. And I like this. Your optimistic view of which level. Is it level 3 or 4? But it is not a level 2 or less. So that's good. And you also said, driver gets assistance from the vehicle, right? That is key. I think for a market like India, right, that will play a pivotal role in changing this industry for personal and commercial vehicles. I like that, and we'll see in another 7 years. I'm of the view, and I'm of the same camp. 2030 mobility will not be the same as what we see. So looking forward. And also, Praveen, when you said platooning and logistics policy, that's really true, right? I think if you can get even some green corridors where this platooning is possible, that will be really that will really open up the both the country and the industry. And Amitabh, you said the tire residual value. That's a very interesting problem, and I know some of us hearing in the panel would be motivated that data plays in different kinds of aspects, right? How do we, so which we would not have thought, and you coming from BCG kind of thing, right, open our eyes. I'm sure it helps many of us in the audience. So Verma, I'll pause here. Verma, go ahead. Have any?
Yeah, so maybe a question on the technology, and based on, you can answer based on what's happening in your companies and the visibility you have, right? While autonomous mobility will take time, right? And Jawahar also alluded to this, right? Where working on this, there are a lot of side benefits, whether it's in the braking systems and other things, right? Where do you see that, right, in terms of happening in the Indian ecosystem right now?
Okay, just as I have met, so take the opportunity. Definitely, as I said, so the technology is transforming, the data is playing a vital role, and when you talk about a mobility, it has basically 3 parts of it: navigation, perception, and actuation. So actually it is not possible that the actuation will not be affected. Definitely the braking systems, just to let you know today, because I come from brakes built for last 18 years. The advantage today what we have for brakes, we don't have to do an input validation, because normally a driver press the brakes, nobody else press the brake pedal. So the liability of applying the brake is on driver, and a system doesn't need to do input validation, because its input is a human actually. In future, think about it. The brake pedal will be on the vehicle. The camera will detect something, and that will signal to the braking systems. Now, there comes a trick. Now, the camera can also have the false positive. There could be an adverse situation. So there could be a situation, the braking will get a request to apply the brake when braking is not necessary. Or vice versa, the braking will not get a request to brake when braking is necessary. Hence, your braking system, your actuation also need to be more intelligent, more smart, more secure, right? And that's how this autonomous mobility or the autonomous technology transformation is bringing you. All the component, all the interfaces must be connected, efficient, and also more secure has to be there. That's how I look at it. It's not only about the perception or navigation, but equally at the actuation as well. It has to be done.
Yeah. So I think we have to look at it differently, right? So the cars that we have seen today, or what we are seeing today, or what we have seen in the last 100 years, has a steering wheel, it has a braking, it has a clutch. I think all this will get redefined, right? So maybe we will not call it as a brake anymore. Yeah, it would be something, management of speed. Yeah, it could be management of speed as such. Because on the highways, when we are today we are talking about one autonomous vehicle or one L1, L2 or some vehicle, right? So different levels of autonomy. Then there are also normal vehicles and so, right? So that is when there is also a human intervention. When the human intervention comes, there is braking. But in future, what I would see is that it would be more speed management, and because everything is going to be autonomous. So when it changes much faster, right? So when it is accepted by the market, it changes much faster. And that is when the whole system that is running today in the vehicles might be completely different, yeah. And there will be a lot of innovations. That is where the gap is today. We are seeing the car as a car, and we are defining the autonomous levels to it, right? But I think we need to look at it differently for different scenarios. May not be from the modules that we have today, but from a different perspective. What it would take for a car to go from A to B without any hazards and so. Autonomous vehicle to go from A to B without any hazards, right?
The technology part is there, and I must say that to bring the autonomous mobility as close to reality as and faster. The other thing is that once you have collected the data and things like that, how precise, how accurate your models are, and whether you build a say machine learning or deep learning kind of model. So, say for example, in these cases, it's not enough to have, for those who understand the terms, and forgive me for those who are not understanding it, it's not enough to have a very, very high F score. So these kind of models must be having the maximum, or rather the minimum false negatives. Like there is indeed a brake needed to be applied, as Ashok was saying, and the brake was not applied. And given the kind of problem statement, these models need to capture those kind of things. Now, how we do that is basically by training on more and more and more and more of the data, which of course, the technology will help us collect, and we build the models, we train the models on that. So that's my take on this topic.
Yeah, at least data side, I think, with this IDD, right, we're doing a lot of work, and even in the other aspects, for example, this iRaste project we're doing, right, the ADAS system that's deployed, right, originally Mobileye did it based on data everywhere else but India. And then after that, they worked with a lot of providers here, but essentially Mahindra had to put it in a car and drive it around for 3 years. And they see all kinds of conditions they don't see anywhere else, right? So they had to do all that adaptation for India, right? So I'll open up to audience, right? Anybody has any question? Yeah, please.
I would like to ask about a different perspective for autonomous vehicle. So there are a lot of mega scale projects happening in India. So when I see autonomous vehicle as a problem statement, so what I see is, okay, what we are trying to do is just from the RGB camera, the sensors of the cars, we're trying to find the trajectory and avoiding accidents and all. What if we design our roads and infrastructure like that, and we put some sensors between the car and the roadways, so that they can communicate and we don't have to rely on AI-based technologies. So I know the whole infrastructure needs to be changed, but that kind of road development and all has been happening in India since the post-independence times. And when I see the future of autonomous driving, this looks more convincing argument to me. And like I've talked to many people about this, but nobody was able to give me a convincing counter argument that why this would be not a solution, but AI-based model are better than this. So I would like your perspective on this.
We'll put the test to our panelists.
So, yeah, so that's the right point, right? So why do we load the vehicle, why do we look at AI algorithms running in the vehicle to solve the problem? That's a good point. So we also have such solutions, right? So between Jammu and Srinagar today, there is a black spot, which was like more than 70% of accidents in that highway was happening there. The most dangerous place in India, that's what I hear, right? So there is a sensor which can, find out vehicles coming on either sides and alert the drivers, right? On both the sides with some sound and so, right? So that is going to be the way. It is not just autonomous vehicle that can drive everything. And I think today, if you see in Japan also, there is something called vehicle information communication systems, which take the government owns this roadside units, which take all the information, vehicle density, what type of vehicles and things like that, and feed it to the map providers, the navigation providers and so, right? So similarly, in our India also, the highways there is a policy to build smarter highways, to count the number of vehicles, find the weightage of vehicles, what kind of terrains, where the vehicles are moving and things like that. So that has to be a platform. There has to be a platform. I believe this will become like UPI one day, where we will be able to access, as OEMs, we will be able to access this information and provide and augment what we are building in the car. It will not be just the sensors on the car, but it will also be from the information that we get from the roads.
So I think very good question, and Praveen rightly answered. If you see the SAE, they try to address this. They talked about GIT, Git platform. The G is governance. That's the law has to play the role. Then is the infrastructure, and then the technology. So one thing you are saying, you can build completely offload and put an infrastructure. That also will not work, because we are dealing with human life. Yeah, so you need to have the redundancy. You definitely need to have the redundancy. So the technology infrastructure has to complement each other. I am not saying it will substitute, but certainly it will complement. It has to complement, because you cannot everything put in a vehicle also. Yeah, we already see the runtime issues. We are also seeing the number of the complex CAN network, complex link, and we are now talking about FlexRay and the Wi-Fi technology within. So there has to be a complement of the infrastructure and technology aspect, and the right balance need to be, depends on the density, the terrain that need to be discussed, but definitely they both has to complement to each other. That's how my view.
See, what I have actually truly observed, and most of the consulting programs that you do, any organization will engage a consultant only when it sees at least 10x of, the return on whatever they pay to the consultants. And I have been part of the, quite a few number of programs, not on the mobility side, but on the manufacturing side to your question, wherein indeed I have seen that, and we have delivered to the clients quite a good ROI numbers by applying AI models, by helping the, or rather by seeing the clients that in this particular plant, and that was a paper manufacturing client, at these places, at these spots in your plant, you have cameras there, we'll collect the data, and that's how we will design, we will reduce, or rather increase the safety quotient that you have. We will reduce the manufacturing expenses that you are increasing and things like that. So indeed, AI has the scope to build upon, or rather to enable the value on the data which you have collected. Otherwise, you will not be able to deliver. You will be just be collecting the data, but the only way to, transform the data to the dollar amount is through the models.
Somebody else has some of the infrastructure we are talking either about traffic on the vehicles on the road or on the space. So there is also waterways where shipping and many other life-threatening ways of living are there. We could use some of these techniques there where you can build fast models, build models very fast.
Faster
and that will relieve freight will move without the people getting locked inside those vessels.
I think there are also autonomous technologies in other fields, right? So if you're talking about that, there is an interesting startup based out of Chennai who work on, so there are this offshore windmills and so, right? So which are in the sea, deep in the sea. And they are working on a vehicle which travels to these windmills when there is a problem, and they can do the repair on its own, right? So this is something that was interesting. And I think it is autonomous as a technology is not limited to mobility, definitely. It is much beyond that. And we are also talking about warehousing a lot, Amazon warehousing and a lot of other things as well. Yeah.
Fully agree. I mean, this is already people are, let's say, leveraging the technology and the concept, what is existing in, let's say, air, water, other fields, so also on the streets. So it's not that something is not been looked at it. So definitely people are reading the things and definitely implementing. So that's already happening.
Anybody else?
On the mobility side, like over and above these autonomous vehicles, so typical use cases which get delivered in the industry, or rather the most popular use cases is on the lines of supply side management, mainly forecasting the orders, the spare parts orders. So that's, say for example, think of it when we did that for Tata Motors or even for Maruti, we were saying that not that with respect to passenger vehicles, but a commercial vehicle, when it gets into the workshop, it has to come out of the workshop faster. And what can increase the turnaround time of the service is the parts unavailability. And I know for sure that Bosch has a very, very, very big practice doing purely spare parts forecasting, like what will be the, the order values and order quantities, 2 months, 3 months, 4 months, and daily forecasting and things like that. So just wanted to add that.
Yeah, so I have a simple question. When we're looking at mobility and autonomous mobility in the Indian market, do you think the market should rather make it for non-Indian countries, let's say set up a base somewhere outside of India, Indian companies set up one lab, one base outside of India and look at, testing it first outside India and then look at the Indian data set? Because let's say the adoption wise, we might not be able to come as far, as early to adoption as let's say certain other countries outside of India might. So would it be a better idea to set up a base outside India and test it there? Or do you think we should train on the Indian data set and then wait for the world to look at how Indian data, adopt from going through the Indian route?
So driver assistance systems, I think this is a big gap in India. So one of the problems that we face as OEMs also is that how do we commercially make it viable for Indian customers, right? So, so Indian customers are still moving from the mainstream vehicles to the SUVs, the first level of SUVs. And it is always, a customer wants to have the best of the value for what the money they pay, irrespective of the segments today. That's the case, right? So I think that is a bigger problem that we need to solve. The problem of safety is there. We are the highest contributors to road accidents and so. And the other side of the problem is how do we make it viable for Indian customers to buy these solutions, right? So I think that is what we should stitch first. Yeah, we are sitting in India, and definitely that is a gap that we need to fix, right? But apart from that, on the advanced economies, the way they are visualized is what we are seeing today. The way they are visualized autonomous vehicles is what we are trying to adapt. But I think that fundamental thing has to change for India, because India is different. How we see a vehicle, how we see a road is completely different than other. So there are a lot of researches going on for the advanced markets, like Japan, Honda already has an level 3. So in US and Europe also there are a lot of research happening, but for their markets. And there are also startups working from India to solve these problems, right? But what we would be interested to see is, as industries, we want to have this solution in India and as frugal as possible for the Indian customer. Yeah.
Yeah, for me it's difficult to answer. Depends on which feature you are talking about. It will change based on the feature. I'm completely talking technology perspective. Certain features, certainly you can do much better in Indian conditions. You have much better data set. Certain feature definitely is easy to qualify outside. So depends on the feature you're working. But in general, if you ask me, I would say it depends on you also. Why not to take a difficult challenge? If you and me can drive on Indian streets, why the technology cannot drive? It's definitely a bigger challenge. But if you want to solve a problem through technology, let's try to solve this, right? And the AI also has to take again, we have a data, we are talking about technology, but if you look at when you drive, you see a pedestrian and you have eye-to-eye contact, he or she is not even moving, but you have an instinct that he or she might move. So that you take a decision split of the second. Currently, if you see our AI models, is not that predictive. If you see a certain movement or leg positioning, then you can predict. So definitely we have to make our models even more mature, so that it's not like a data-based, also it should be instinctive. So that is something we have to go, and technology has to be mature. Yeah, so it depends on the feature, you can choose it, and India is definitely not a place where you cannot test it. That's how I look at it.
Some of the future data sets, I think we're looking at pedestrian intent and other things, right? So it has to get to that level, right?
Yeah. See, any, say modeling like image recognition or video analytics, you have to train it on the local data sets. Otherwise, given the scenario where you can't afford to have too many false negatives. So yes, you are right. Say suppose if I train my models on the US data set or a Europe data set, try to apply it in India, it will not work. Clients will not take it.
Okay, I think we might have to wrap it up. Andrew, concluding comments, we'll wrap it up.
Yeah, I know, maybe, thank you panel, it's very, very interesting to hear. I think we are a little over time, or probably, ending up, and Verma is giving the signals already. So yeah, I would like to hear your closing comments, and in your closing comments, and there are, some students, I'm sure there are many of them here in the panel or in the audience. So would like to, please share an interesting problem that is not yet solved in, in the aspect of work that you have seen, right? So that will motivate people who are, people in the audience. That could be a take-home message from you to the audience. So with that, I thank you very much, and Verma, you take over and conclude. Yes.
Go ahead. Yeah.
You want me to give some problem statement? At least I can give 2 problem statements.
things that you think are yet to be solved, or very interesting problems not yet addressed, right?
Yes,
that will motivate the audience and students.
Correct. So today, if you see this autonomous vehicle, I think Praveen also talked about it. Today, you have a lot of regular vehicles, and then one vehicle which has some radar, lidar, camera mounted and moving around. So it's okay. You are gathering data and you are getting all the data. In future, think about it. There will be multiple autonomous vehicles. Then the problem which you might look at it, the radar principle. As you know, radar basically works with the reflection of radio waves. So imagine a case if the road has a lot of autonomous vehicle and all these radars are throwing the radio waves. Now once you are receiving the radio waves, how would you distinguish, is it your own radio signal or somebody else's radio signal? So that is something that would be really interesting to understand if you're able to solve the interference, basically because if only I am the transmitter and I am receiver, I know, okay, I sent it, I heard it, fine. Now, if you are listening a radio wave, it would be a very good problem if you guys can take it up and come back to us. I'll be very interested to see that part. And second, in Indian context, I think lane detection, I mean, we are working with an Indian OEM. And again, would be very happy if you can solve it, because certain times what happen, there are the markers on the street, and sometimes it's a pretty good visible. Sometimes there are the muds on that. So and sometimes roads are broken. So if you can predict the vehicle to still keep the lane in those conditions, would be very interesting, right? Because 100 kilometer, 90 kilometer, you have very good road. 10 kilometer you have not so good road. So if you can make that, will be again very good problem statement to solve, and we certainly welcome you if you have the solution.
Internships at ZF, right?
Yes, I said definitely these two problems. I throw you an internship program. Sure.
Praveen? Well, Amita, you probably will see a lot of interesting problems based on your
see, I relate more to the healthcare discussion which was happening, and given that the students are not limited and are not bound to only work on this mobility stuff. See, the best way to make AI popular is to make it, or rather make it reach to the rural India and all that. So, lot of the data. So currently my program is with the Ministry of Agriculture in Government of India, and very soon you will see that, the way you have something like Aadhaar, very soon everyone will have a pharma ID and things like that. So we are working on a lot of vernacular data with all the state governments. So there are a good number of NLP problems that need to be solved on the vernacular data. So BCG has partnered with Government of India as well as the IIT Madras through, on all three of us are solving this problem in terms of how to make the database decisioning more accurate when you have a vernacular data and not an English data, typical English data. And that is something which you will see that it's not that solved that well. The models that we are running are not giving that good scores, but it is indeed doing the better job. So if you happen to come across Aksharantar website, I think it's sponsored by IIT Madras, explore that data set. It's an open source data set. Build some NLP models on that, and see whether it is, how good your NLP models with respect. You will not find much, much content on the Kaggle as well, and those kind of solutions, if at all you come across, they will indeed be very innovative.
Thank you, panelists. Anything, Praveen?
Yeah. So what I would give as a problem is very basic. Professor Jawahar mentioned about education, right? So I think it starts from there. So not just giving the technology on the vehicle, giving the technology of the vehicle and assisting the drivers, it could not be 100% successful in my view, unless the driver understands what he is seeing, right? So today the biggest problem is we are all into this digital world and getting the customer's attention, right? If you are saying that there is an accident, you need to be careful and so, how would you convince an Indian customer, right? The experience that they will go through listening to what you are trying to prompt, yeah, and how we are going to prompt. That also comes with the language problems, the cultural problems, and things like that, yeah. So that would be an interesting thing because our problem is not the technology. Technology, we will get it. Our problem is how you convey the customer, yeah. That's about it.
Thank you. Thanks, everybody. I see Prakash waiting though. Thank you.
Very nice. Thank you. Thank you very much. And thanks, Verma, for helping me there.
I request three of you to stay back for some more time.